Hello, this is Therese from the Asia eHealth Information Network. Welcome to our Aging Hour, our bi-monthly webinar series where we feature topics on eHealth, health information systems, and information technology for civil registration and civil statistics. Today we'll learn how healthcare providers in Canada provide appropriate care and remote physical examinations through telehealth. Some things to remember before we start: the platform, how to participate, and the email feedback. We're now using Cisco WebEx Event Center. If you're encountering problems in joining, log out of the session and rejoin immediately. Our meeting room number is 839-463-359 and password is Canada123. Your mic will be mute in this meeting, but you can send your thoughts to us by clicking the chat icon. For questions, click the Q&A tab and key in your queries. After joining, you will receive an email evaluation form. Answer the form so we can send the slides and other resources of this meeting to you. Today we have Ms. Margarita Loyola, who has been working for the healthcare field for over 20 years. She's made of years of experience and service and vast knowledge on engineering and health services. While she was born and earned her undergraduate degree in Mexico, she pursued Masters in Engineering from UBC in Canada. She also has an MBA from Tabasco University, a Health Services Management Diploma, and is certified in Clinical Engineering and attained the CPH-IMS-CA certification. She is co-chair of the BC Telehealth Development Committee and chair of the Advisory Committee for the Canadian Telehealth Forum. Without further ado, let's welcome our speaker, Ms. Margarita Loyola.
Hi, can you hear me?
Yes, we can hear you.
Oh, okay. So I'm just going to, I was just trying to figure out about sharing my presentation.
Yes, we can already see your screen.
Oh, okay, wonderful. So let me just fill it out on my side. Very good. So thank you for the opportunity to present to you. I also have with me a member of my team, Lisa Safrek, who will also speak to you later on in the presentation, and her focus is more clinical than myself. So what we want to talk to you today about is a bit of an introduction and about telehealth in Canada, specific to us, Island Health Telehealth, because we're just a little piece of Canada, and then some of the programs and technologies and innovations that we have developed here in Island Health, and a little bit of our future, next steps, and of course we're happy to answer your questions and anything. And I was just wondering if after the presentation, perhaps you can let us know who is participating from your end, because we don't have, we're not familiar with this Asia Pacific network. So later on, maybe we'd like to hear from you a little bit. So I'm going to get started. Okay, so I need to zoom. I'm just wondering if the presentation, oh yeah, now it is. Okay, I just want to make sure. Sorry, I was speaking to the overview, but you weren't seeing that. So, okay, now I think we're in synchronicity. So I just wanted to show really how far we are. So we are in Canada here, and you're in the Philippines. And I just keep going farther. We are 10,000 kilometers away from each other. And that would be a 15-hour flight. So, big distance amongst us. And let me know if I speak too fast and if you need that I repeat myself, okay? So again, just to let you know, this is where we are. So in Canada, healthcare is universal. That means everybody has access to basic healthcare services And that includes all your stay in a hospital, your surgery, any visits to physicians, any day, any time. And it's all paid through our taxes. And so the healthcare is publicly funded. That means we don't have to pay privately. If you go to the doctor, you don't have to pay. It's all covered through our universal healthcare. And but it is expensive, and many of the provinces in Canada spend over 40% of their gross domestic product on healthcare. So it's very, very expensive. Telehealth is, I'm sorry, I'm just going to my screen because this is, anyway, so the telehealth, and I don't know if all of the audience is familiar with what telehealth is, but it's very similar to what we're doing, except we should be able to see our faces and chat with each other. And mostly as one-on-one, actually, so it's not that similar, sorry. Telehealth brings care closer to home. In our country and in our island specifically, we also have very large distances. So connecting patients and doctors is very important. And it doesn't have to be doctors, any healthcare professional. It could be counselors for mental health, could be, therapists, physio, OT, like occupational therapists. It could be nurses, clinicians, in any really healthcare professional that could help you with your healthcare journey. So telehealth in Canada is available pretty much all throughout the country, and it's becoming more and more pervasive. There is, I think there was prediction that 25% of all consultations are virtual right now, and I don't know if we have surpassed that number or that prediction. Okay, so moving along. So as I mentioned, telehealth in Canada exists in all the provinces and territories. Every 2 years, we do a national survey of number of consultations and what type of consultations, how many video conference units we have throughout Canada. And this year, we just completed this report, and we have completed over, close to 500,000 consultations. This is all in Canada, not just one place. And we have over 7,000 endpoints, which is like a video conference unit where the patient would have a consultation from. And in terms of programs, we, you name it, from A to Z. So, anesthesia to thoracic surgery, cardiology, diabetes, genetics, geriatrics, oncology, pediatrics. Pretty much, you name it, it is available. And however, even though I say that, there's still a lot more work to do. So this is a slide of 3 years ago of the previous report. As I say, every 2 years we do a national report. This year, the slide hasn't been published, but it will be in September. But as I say, this year, Canada-wide, we did close to 500,000 consultations. But this slide gives you an idea of all the provinces and territories in Canada and how really telehealth exists everywhere in some, in some shape or form. I understand you heard from Ontario and how they do telehealth. So we are now way at the other end of the country in British Columbia. So this is British Columbia. It's the most western province in Canada. And so we are we're facing the Pacific Ocean, same as you. And British Columbia is also, a very large province. In terms of land, I believe is 3 times larger than all of the Philippines. So it's very, very large geographically. Population is dispersed. We have First Nation communities in very rural and remote places because we have, a lot of water and islands as well. Some of the transportation has to happen either by airplane or by ferry, as you can see in the picture. Northern parts of British Columbia have a lot of snow in the winter, so transportation is challenging for patients to go and see their physicians or clinical consultations. In British Columbia and pretty much in the same as in other parts, the medical specialists tend to concentrate in the urban areas, like the big cities. And so that leaves all the other people having to travel to where the physicians are, or the specialists. Most places will have, like primary care physicians, but specialists and subspecialists are really only in urban centers. So this is, again, a demonstration of British Columbia. BC in itself is divided into different health regions, okay? So in this picture, you can see the Northern Health region is, very, very large, demonstrated here in green. Interior Health is also very large. It's demonstrated here in blue. And I'm speaking from Vancouver Island, the orange section in this map. And then there's some others. In terms of population, each of the health authorities have approximately very similar population. Perhaps Vancouver, Coastal, and Fraser, which are the more urban centers, they may have the largest concentration of people. And Northern, Interior, and Vancouver Island, I think we have approximately the same number of people. Island Health has 765,000 people, so just so that you know. These are some pictures demonstrating how we do telehealth here in Island Health. And I'm not going to go into detail this minute because Lisa is going to speak in detail about all of these clinical services and tell you, a lot of information. And of course, you can, ask for more information later on, and we can certainly pass on any of our documents and papers and anything we have done. We're very happy to share. So in terms of our telehealth program, we have telehealth in 22 communities across the island, and we have 58 telehealth rooms. So up and down the island, we pretty much have telehealth everywhere, just about. I mean, we still have a few that we haven't, reached to. And our barrier to reach to the very rural places is the lack of connectivity. And I'm sure you face some of the same barriers. Some of our very small and isolated places, they just don't have the network connectivity to support the technology for telehealth. So anyway, so I show here, some of our statistics. And to date, we have done close to 18, actually very close to 20,000 sessions, like telehealth sessions, in the last 7 years. Like it took us about 5 years to reach our 10,000 number, and we have to update this slide because we are very, very close to having a 20,000 telehealth consultation, like maybe in a matter of a week or two. So we've done a lot, in the small, in the few number of years that we've been working. So this is again a slide of the island, and it shows in there all the communities where we have telehealth. As I mentioned, we have telehealth in 22 communities. So all the green dots are the communities. Some of the communities, like the bigger cities, have more than one telehealth room because they're larger. There may be 2 or 3 hospitals. There could be a mental health center, a community health center, a health unit. So we may have, sometimes 5 or 6 telehealth rooms in a particular city. So the photos that you see there are our team, and our team is spread out through the island. So we don't all live in a single city. We are spread out up and we connect with each other pretty much on a daily basis. At least, the members are connecting with each other constantly. We collaborate, we share the workload, even though each member has very specific roles to play. And just for fun, we are showing there our little mascot, my dog. He's all dressed up with his rings for surgery. Okay, so today this is me and Lisa here. So the 2 of us are speaking to you today, and some of my team members are actually connected and listening because, as I say, we like to do everything together. So some of my team members are connecting here today. So some of the things that makes us very, very successful in Island Health, and as I kind of showed, Canada is really, really big. Then British Columbia is the western side province, and within British Columbia, we're divided into 7 health regions, and I'm just speaking from one of those health regions. So we are really a very tiny spot, in the context of all Canada. But and that's why our team is very, very small. But as I say, we work very hard and are very successful. So some things that makes us very successful is that we have telehealth standards. We have developed a lot of documentation for our doctors, physicians, clinicians that provide telehealth consultations. We have standards for the people that help, meet and greet those patients. Like in the picture here, you see a lady there by our telehealth cart. And she is a lady that is in one of the healthcare centers where we have telehealth. And her role is to bring the patients into the telehealth room and to make them feel comfortable. And they sit down and she tells them the doctor is going to connect. You're going to see them here on the screen. And make sure that everybody is on time and in schedule. If the doctor is connecting late, she will tell the patient, don't worry, the doctor's coming, type of thing. So we have processes to ensure that the doctors know where their patients are connecting from. They connect, they have a session, they disconnect, they do their dictation, and all their clinical documentation is available, and to all the healthcare providers that have to do with that patient. And the patients can also see, and the doctors can share the x-rays of the patient or lab results. So if the doctor needs to refer to an image, he can show it on the screen and show the rest of the people. Okay, so this is another, this photo here shows actually one of our telehealth rooms. And the lady there is one of our telehealth members. Her name is Serena. She lives in the north of the island. And this room really shows how our rooms look like. So we have a cart that you can see there. And so it has a screen and a video conference. And all of our rooms are standard. They all look the same. So no matter where the patient goes, it all looks the same. We ensure we have good sound quality. And we have standard materials so that the doctors know what to do, where to connect, and everything. So this doctor in the photo, he's a GP, like a general practitioner, like a primary care physician, and he connects to little islands off the island so that people don't have to travel by ferry to come and see him. And he connects to, very remote places. They are located in the tip north of the island, so they're already very remote from, from the urban centers. But he still connects to even more remote places, and he uses telehealth for that. Sometimes he does have to go in person, but he's a real champion for us. So in terms of our consultations, so, we have education sessions, like I'm sure everybody does. We have clinical sessions, like the top left, that is a renal session, like a nephrology. And the lady there is doing an assessment with one of the patients. On the right-hand side, on the top right, we are showing how we need a nurse or a clinician with the patient to assist with some of our, programs like cardiology, genetics, and Lisa will speak in more detail about them. The bottom right shows our home health monitoring, and again, Lisa will speak in more detail about it. But basically, patients are at home; they measure their own blood pressure, weight, pulse oximetry, and this gets uploaded to a central location where a nurse can monitor. And Lisa will speak about them. This program has been extremely successful. So I'm gonna tell you a little bit about speech language pathology, because this has been also a very successful program for us. So patients that have say Parkinson's disease, or that have had a stroke, or for some reason, I don't know, they need speech language pathology, oftentimes need to travel to see the speech language therapist, because we only have speech language therapists in 2 of the cities in the whole island. And say we have telehealth in 22 communities. Well, 2 of those communities have speech language therapists. So all of the other communities, patients need to travel to see this lady or others. And sometimes patients need to be transferred, like they are acute care, like occupying a bed in a hospital. And sometimes that needs an ambulance transfer to come and have a speech language assessment. And she will look at your swallowing. So on the right, we're showing how with a camera, we can show the throat. And she can, ask questions, and she can see the patient and do her assessment. And this program has been very, very successful. And as I say, we have been able to avoid some ambulance transfers so that patients, don't have to be transferred for these assessments. You can do it through telehealth. And this is another program that I wanted to mention or highlight because it's a new program for us, multiple sclerosis. This photo is showing the nurse, the multiple sclerosis nurse, and one of her patients. So in the island, we have a number of patients with multiple sclerosis, and the neurologists that look after these patients only live in Victoria, which is way down to the south of the island, and that's our main, capital city. So patients, as you can imagine, with multiple sclerosis have very difficult mobility, right? And it's very hard for them to travel to see the neurologist down south. So this is where telehealth makes a big difference. So this new program that we have, we hire a nurse, and she specializes in multiple sclerosis. And she has an office in Central Island, so not way to the north, but at least not in the south. So patients in the north and central can go and see her, and she does the assessments, and she connects with the neurologist, and they can have like a 3-way consultation. I'm showing in this picture the neurologist. This is Dr. Geriartrics, and she is in Victoria in the south. And in the screen, you can see the nurse, and in that chair where the, in that photo where the nurse is, that's where the patient would sit. And they have consultations, and it's been really successful. As I said, this is a new program, and we've had 66 consultations already, and 30 really in the last month and a half. So it's really growing in popularity, and it's working very well. We had another program, and I don't think that we included a slide about an amputee patient who was had to come to Victoria for his surgery and was in another town also close to Victoria for rehabilitation. We were able to discharge him home like close to 3 weeks earlier than anticipated, and his home was way in the north of the island. So the only reason to be able to discharge him early is because we could do telehealth, and the nurses collaborated and did a very close examination of his wound and his prosthesis, and ensured that he, could move on and have a normal life. So anyway, so telehealth has been very, very important to us. I'm going to pass now the podium to Lisa Safrek. As I say, she's our nurse and clinician leader and specialist, and she will take you through some of our other clinical programs. So maybe take the center. Okay.
Thank you, Margarita. Hi, thank you for this opportunity of allowing us to share our practice with you. Continuing our presentation here at Mental Health, relatively new program for us here at Island Health again, Telemental Health, but huge success already. You might have noticed on a previous slide that we have, by introducing Telemental Health to our more northern regions on Island Health, we've reduced wait times to see a psychiatrist by 83%. It's absolutely massive for these communities that are remote and simply do not have access to psychiatric services. We actually only have 3 sites on Vancouver Island that have psychiatrists, so our ability to connect to the rest of our communities on the island and share these clinical services is making a huge difference. And also this year, we have just started doing tele-urgent mental health. So when someone comes in acute psychosis or is a danger to themselves or others, that they need to be committed under our Mental Health Act, we are able to use telehealth to connect them to a psychiatrist on call and determine whether they need to be transferred or whether they can be safely supported in their own community. And this is making a massive difference in preventing the transfer, but also getting that care started and that clinical relationship established very early on. So you can see from the slide that the treatment is starting sooner, we're lowering our transfers, and people are being discharged earlier. So all of that, while always good for our budget, is much better care for our patients. TeleGeriatrics is one of my more favorite programs. We have an aging population as does most of the world, but certainly on Vancouver Island, we have probably the biggest concentration of seniors within Canada. It's a lovely climate. And the coastal communities and such, they really draw a lot of retirees. And unfortunately, we don't have a lot of geriatricians, and most of them are located on the southern tip of our island. So how do we then get this very specialized and very unique care to the rest of our older population spread out across the island? Pictured here is Dr. Malone, and she is an amazing telehealth advocate who has worked with the seniors nurses and her colleagues, other geriatricians, and they make full and complete use of all of our peripheral medical devices. So our telegeriatric process is slightly complicated, but they have worked it out really well within their team. So they need to assess if that patient is appropriate for telehealth. Is that a good care modality for that person? We have had experiences where someone had a delusional disorder associated with Alzheimer's disease, and they simply could not process that that was a physician on the screen they were seeing, and therefore that was simply not going to be manageable for that person. So the nurses at the client site will make that determination. Also, before the telehealth consultation with the geriatrician, the nurse will complete whatever cognitive and functional testing is needed, and they get that direction from the geriatrician. And of course, very important is that the client is consented before the consultation begins. It's absolutely essential that they understand how their consultation is going to be delivered and that they consent to receiving their care that way. during the consultation, which they used to spend 2 or 3 hours doing geriatric consultations, but now with not having to travel for the clients and or the geriatricians, it's divided into those 2 sessions where the nurse meets with them initially, and then on the day of their actual consultation, Dr. Malone or one of the other geriatricians will connect via telehealth, and they operate the camera because they're not just speaking to this patient, they are doing a full physical assessment using the technology. They will visualize their ears, nose, throat, any other areas of concern using our portable cam scope, and they will listen to heart, lung, bowel sounds, carotids, all through our electronic stethoscope. So the nurse will operate the stethoscope, which is pictured here, and the geriatrician can hear everything that the nurse can hear. They also will do gait assessments, and so have the client walk up and down in the room, and the geriatrician will operate the camera on their side. So a very, very thorough assessment and huge success. They absolutely love telehealth and never want to be parted with it and are very excited to expand it to other areas of the island. This is Dr. Liz Swigum, one of our cardiologists, also located down in the south of our island. I'm sure you're hearing a bit of a theme here, but most of our specialists are down in our most populated city, Victoria. And she, again, is another wonderful telehealth advocate who first started working with our electronic stethoscopes and providing her care that way too, so that her patients did not have to travel. So here you can see that on her screen to her right, she is engaged with her patient, and the nurse at the client site is listening to heart sounds, and Dr. Swigum's also listening. And then you can also see a lovely screen there to the left, which is our stethoscope application. And Dr. Swigum can use that application to let the nurse know where she would like the diaphragm of the stethoscope placed. So where on the chest, be it anterior, laterally, depending on where on the heart she would like to listen, especially for murmurs and such like that. So really nice application. Nothing is stored. It is only real-time sharing. So right now we're not connected to the electronic health record in terms of actually recording and keeping the heart sounds, but a wonderful tool for sharing and preventing travel. And this program is used throughout the island, pretty much just about everywhere that we have a telehealth endpoint. As Margarita shared with you, we are doing telecardiology. And this is a closer picture of that application that I was just mentioning here. So that the screen can be, and also TeleGeriatrics also uses the same application, and they can move the stethoscope application dot anywhere. So if they want the nurses to know where on the lungs or the heart they'd like them to listen, they can do that. And it also gives a waveform for as it listens to the auscultates the heart rate as well. Home health monitoring. Margarita let me know that you had a special interest in home health monitoring, and it is a program near and dear to my heart, as I do spend 50% of my time as a project resource for this program. This is Bill, one of our home health monitoring clients who has completed the program. And the thing that I really love about Bill is when we were just talking to him last week, he mentioned, he said, you know what, I don't want you to call it heart failure anymore because I have heart health. And that just says so much to me about what this program did for him, in that he walked into a doctor's office one day and he had a sort of a unique circumstance into his heart failure, but did not have a heart attack or anything like that, but likely had a virus or something that caused it. And so all of a sudden, a flurry of activity for him, complete change to his life journey and what he thought it was going to look like, and was left at home wondering, what are my next steps? In comes home health monitoring, in which he now is receiving support in his home without having to travel to the hospital around education for his heart failure, increasing his knowledge of the condition and especially the danger signs so that he can react and understand what's happening, massive improvement in health outcomes, and most importantly, because this is what's important to the patient, is an improved quality of life. And along with that, we've also saw a great reduction in acute care utilization. So our home health monitoring program is much more than about the equipment. It is about the connecting that person to healthcare in their home. Our home health monitoring service right now is only has one care plan, and that is for heart failure. We are looking forward to expanding to other care plans. I think our next one will be COPD, so chronic obstructive pulmonary disease. And I can't wait till we can bring it on to early discharge and diabetes and multiple other chronic conditions. So right now, our clients like Bill here would get up in the morning, and right after they've gotten themselves out of bed, we like them to do their weight, their blood pressure, their oxygen saturation. They respond to 8 simple yes or no questions on the tablet, and then it gives them a summary screen. And this is where we really start that self-management aspect. And that right from the beginning, we ask them to record those responses on that summary screen into their booklet, because that really helps them think about what those numbers are. They're not just relying on the information being sent to the nurse and such. And we have heart failure zones. So we like them to be in the green. And if they're in the yellow, they need to think about what needs to happen. And if they're red, they need to seek urgent medical care. So it keeps it nice and simple, just like traffic lights, green, yellow, red. And so really getting them thinking about what's happening today. How am I feeling today? What are my concerns? And of course, all of that information, their measurements and their responses are sent to the home health monitoring nurse. So the nurse in turn responds to alerts that are created from the results. So if their blood pressure is too high, their pulse is too low, if they have answered yes to any of the questions, like I'm feeling short of breath today, I feel dizzy, I have chest pain, and they then use a clinical pathway to respond to those questions. Ongoing communication with the client in terms of self-management support, heart failure education, assisting the client to meet their health goals. And that may mean walking around the block or going to their daughter's wedding. The nurse also sends reports to the client's physician and ensures that they know what to do when their results are a little bit off and when they need to seek additional care. So we like to leave them with lasting resources on how to manage their health. Huge benefits with our home health monitoring program. We have seen with the clients that have participated in the 3-month service, we have seen 67% reduction in admissions, 59% reduction in length of stay, and 53% reduction in ED visits. And of course, as a nurse, what means even more to me is what it looks like for our clients. And they feel like they are able to live healthier and better lives with their heart failure. They can detect and intervene earlier, and this has been one of the third bullet here is one of the things we've heard most of from our patients, and that when they go home from the hospital or after a diagnosis with heart failure, they feel very alone and very frightened. Home health monitoring increases their confidence, and they have much less to worry about managing at home. This is pretty much the end of our presentation. If you would like some more information about our telehealth resources in our program, then I highly suggest you visit our public website, www.vha.ca/telehealth. You can also email us if you would like to talk more about these programs or get some more information. We're happy to work with you, telehealth@vha.ca. And it looks to me like your host there can share our presentation with you. We're happy to do that. Any questions for Margarita or I? And thank you very much for allowing us to present to you.
All right. Thank you for this wonderful lecture, Ms. Margarita and Ms. Liza. Now we'll be answering questions from our attendees. Okay, so for the first question, the question is, how did the telehealth program start and when? Is it small scale or with big, large funding?
Okay, so answer to that. So our program just started with hiring. So they myself and really begin the program in Island Health. And so that's some funding, like a manager for that. And in addition to that, I was with creating telehealth in the island. And we started very small. I think the first year we had 4 rooms. As I say, we have 58 now. And the first year we had 4. So that's kind of how we started, a little bit at a time. the other big thing is that we initiated some key programs with telehealth. So at the beginning, we didn't have all the clinical programs that we have now, but we started with oncology and thoracic surgery. And in oncology, we had a great champion who really helped promote, telehealth to his peers. So anyway, that's kind of how we got started, and we just started to grow. So started with one person, and now we are 9. And we continue to have funding, and every year we buy a little bit more equipment and do a little bit more. So slowly but surely.
All right, thank you. So for a follow-up question to that question, what is the investment cost and continuing expense?
Okay. So as an answer to the continuing expense, that one is really the largest expense for us in telehealth is really our own salaries. But I have to say that we are very lucky in the fact that there is a network department that has laid network and connectivity across the island and into most of the sites. So I usually wait until there's network in one site before we go and introduce telehealth. So, for example, for the longest time, we've been wanting to go to this little community, which is in the west side of the island, that is called Banfield. And I've been 8 years in Island Health, and for 8 years I haven't been able to go there because they just didn't have the bandwidth. And I just don't have the funding to go and invest in networking and that sort of thing. But now the network people have introduced bandwidth and, a bigger bandwidth anyway to this community. So it is in my books or in my plans this year, we will introduce telehealth. So what I want to say is I am not in charge of introducing network to the community because that is a big cost. So I'm not counting that cost because I'm not in charge of that. Like I have a different department that does that. Well, not I, but the island. So because I don't introduce the network, I don't have to, do that kind of investment. But as a country or as a health authority, as a region, that is a big investment to ensure there's connectivity. The other investment has to do with the equipment. But I would say the cost of equipment have gone down so much that it's not really a big thing. And I think software, like we're doing today, is a very good option. And in fact, that's how I want to go in the future, away from video conference devices and into software. So to me, specifically talking about my program, the biggest expense is our own salaries, which is the human resources.
All right. So we have another question, Ms. Margarita. The question is, what software or database do you use?
So we are not using software yet. We want to go in that direction. So we just use video conferencing equipment. But if you are meaning in terms of the patient information, that is the electronic health record that the island is using, and it's Cerner. But this is really a prerequisite for telehealth, not necessarily, let's just say, part of what we do. The electronic health record is, again, a separate area, and the doctors use it, of course, to look at the lab information, consultation, patient information, and the history. But we don't necessarily, again, created it or have the cost associated with that. And we don't store any data at the moment. Our telehealth sessions are live, like real time, except for home health monitoring. So that is really an exception where we do have a program for that, and we're working with one of our vendors, which is TELUS. So this program, actually the program itself doesn't store data, does it? The home health monitoring, but the data goes into the electronic health record of the patient. So anyway, so we use the electronic health record for the patient. for any data, any consultation, any clinical documentation that has been associated with a telehealth consult, be at home or in the office.
All right. But for the electronic records, do patients can patients access the system, and what is the procedure for data privacy and security?
Okay, so there is Freedom of Information and Privacy Act in Canada and in British Columbia. So there is a process where patients can access their electronic health record. But again, this has nothing to do with telehealth, okay? There is just a process. You can be a patient, have surgery, and you want to see your record. You go through the Freedom of Information and Privacy, and there's a request. You request that you want to see your record, you sign it, you make a petition, and then you get a copy of your record. This has nothing to do with telehealth. Telehealth is really just the act of having a clinical consultation and in real time.
All right, thank you. We also have another question. Are consultations only for elective outpatient consults, or do you also do emergency consultations?
So the vast majority are elective, and we are starting to do emergency consultations. So I referenced that with the Telehealth mental health, that we are emergency ones. So they are up in our northern community, psychiatrists in acute psychiatric crisis. And we're also looking at a project coming up to prevent connections between our department by using telehealth as well. So we are more into consultations.
Okay. We also have another question. Do patients pay for the services, or are they for free?
The services are free because it is considered clinical consultation. You go to the doctor, and specialist consultations are a referral. So say if you go to your primary care physician, your general practitioner, and the physician says, "Oh, I need you to see, say, a surgeon," or they will make a special, and then that consultation takes place over telehealth. So patients have access to healthcare services in Canada, and that is a part of the universal health care, and there is no cost.
All right. Another question is telehealth used as well for the non-island areas of British Columbia?
Yes, it is. Telehealth, because it really is a connectivity between a patient and a clinician, the patient can really be not necessarily part of the island. In fact, some of our doctors provide care to cities that are outside of, say, our health region, and we let them use the technology and the connectivity, and they can connect with patients elsewhere. And the other way around works for us as well. We have our patients in the island have access to some clinical services that are provided from Vancouver, from Ontario, from Alberta. So, wherever the doctor is, and again, we can connect over telehealth. So they don't have to be all in the island.
And I think we missed a question there. Sorry, I'm just going to jump in here about, can you share summary figures on the mix of the cases, how many are TeleGeriatrics versus home monitoring and such? So the vast majority, well, I should say the vast majority, but the majority of our consultations are oncology. So that, and as Margarita's referenced, that was one of our first programs that we engaged with and had champions from and such like that. And then after that, I would have to say it would be telemental health, telecardiology, home monitoring. We're sort of doing separately right now, but about 150 to 200 clients a year, and we're looking to double that in the next couple of years. As I say, it's a relatively new program to us, all our other new programs are coming on so quickly. Like I think multiple sclerosis will be one of our top ones very, very soon. So they're all growing very, very rapidly.
Yeah, and we're happy to share our statistics. As I say, we are maybe a week or two from reaching our 20,000 consultations. So for us, we are a little place in all of Canada. It's like a lot, and we're a small team. So we're happy to share our statistics and the mix of our programs. But in our case, oncology is our largest program. But when we look at all of Canada, mental health is larger in general, like in the rest of Canada. For us, it's oncology. And like Lisa said, followed by, other programs like multiple sclerosis, geriatrics, and others.
Okay, thank you. Next question is, what was the acceptance, the response or reactions to telehealth from clients?
Do you want to answer that? I think it's like accept telehealth.
Oh yes, our clients love it. We reference on one of the slides that we have a survey in the room, and it is a provincial survey that we then use to collect our local statistics, but it allows us to put all of our provincial statistics together as well. Overwhelmingly, 99% of our clients would use telehealth again. We're very open with them that this is an option in terms of receiving their care, and if they would prefer to have it in person, then absolutely that would be respected. But as I said, 99% of our clients who complete the surveys would happily use it again, and we actually have clients who show up for telehealth when they actually are supposed to be having it in person, so they kind of just say, well, I'd rather have telehealth. The other thing, a statistic that we really like to share is we found that of the ones that had answered this survey, 600 of them would never have traveled to receive that care if they did not have access to telehealth. So they simply would have said, no, I can't do this, I can't manage it. And especially we start getting into telemultiple sclerosis where, the physical impediments are just too much for them to travel 6 hours in a day. And so the only way they're going to get this specialty care is through telehealth. So overwhelmingly, our clients absolutely love using telehealth and are very happy to have access to the service.
And the doctors also realize that they are situated in the south of the island, as I mentioned, Victoria, and they realize they cannot physically go to other parts, all over the island to see patients. And it is too much to ask patients to oftentimes travel for 8 hours to come see them for 10 or 15 minutes and then go back, to their home community, oftentimes, having to spend the night, and people that can't drive because they're sick, they have to have somebody drive for them, and that person may have to take time off of work. So doctors are very conscientious of that, and they love it because they can also see more patients and feel satisfied that they are helping those patients stay in their own community and they're receiving the care that they need. Our satisfaction survey asks questions like, did you get everything you needed, like all your questions answered? Were you able to hear the doctor? Did you feel respected and was your session private? Like, it has all kinds of questions, and so we rate a number of areas from the patient perspective, and doctors can also email us. Like, we have a generic email, telehealth@viha.ca, and doctors can also email to us if they have a request or an issue or something.
All right. So another question is, what happens during times that connectivity is down?
Okay, so if for some reason connectivity was down, so we have, put it this way, the worst case scenario is use the phone, right? And so one of our, I guess part of our procedures is that the doctors we always have a phone in the telehealth room. And we have a big note in the phone that tells the patient, if the phone rings, pick up, because it could be your doctor. I mean, in case they weren't connected, obviously. So if the doctor wasn't able to connect because there's an issue or something, the doctor has information of the phone number of all the telehealth rooms, and they can actually call the patient and, continue their session over the phone. So let's just say that that's one scenario. Another scenario is they will have to reschedule. And we are working right now, I can't say it's live, but we are putting software video into our telehealth room. So if the video conference was down, then hopefully the software can kick in. Mind you, but if the network was down, I guess that wouldn't work either. So I guess we go down to telephone, and worst comes to worst, they would have to reschedule. Because the majority of our clients are non-emergency, they're really like pre-scheduled ambulatory care clients. It's a nuisance, but it's not the end of life. If it was really an emergency, like the ones we have for psychiatry, I'm sure we would figure something out. But as I said, the phone is always an option.
All right. The next question is who pays home telehealth? Is there any co-payment patients need to pay?
It is completely free for our clients. We have to pay for our funded healthcare system. But no, all of their care with home health monitoring is provided for free. They don't keep the equipment. We don't have an option right now for them to purchase the equipment. But what we do is encourage them right from the beginning, much like we do in acute care. We start the discharge planning right from their initial enrollment in home health monitoring, and we encourage them to purchase at the very least their own scale and hopefully their own blood pressure monitor as well, which can be done at very reasonable prices. Both should be obtained for less than $100, and that they continue the monitoring after their discharge from the service. But during their actual time in there, they do not. There's no payment at all. It's all free services.
Okay, so for the next one is, are the consultations pre-scheduled? How much lead time is allowed to do that?
So yes, consultations are pre-scheduled, as I said, except for the emergency ones, but even those, there should be a few hours in between a call and then the consult. But all the other consultations are pre-scheduled. And in terms of lead time, we give, we have like a scheduling system in which the programs themselves can schedule the telehealth room, and they can schedule their own physicians or clinicians. And so they can kind of work out what works best for their doctors. And if there's available time in our telehealth room, they can just book the patient. So oftentimes they can put in the patient the day of the consultation. I mean, that's kind of the worst case scenario. Or they can book, doctors have scheduled that maybe even a year ahead of time, right? Because they know they have to see a patient every 6 to 8 weeks, for example, or every month or so. So those can be all pre-scheduled, way ahead of time, or as need be, like sometimes the week before, 2 days before, because we give them access to scheduling the telehealth rooms. And as long as there's availability, they can go in and take the spot.
Okay, thank you for answering the questions comprehensively, Ms. Margarita and Ms. Lisa. And thank you for our participants who sent in interesting questions. Sorry, but we have to cut the Q&A part now. For the questions that we weren't able to address, we will be sending your questions to our speakers and upload them on our website together with other materials. Okay, so thank you, Ms. Lisa and Ms. Margarita, for being with us today. Also, our participants who actively joined our session. Everyone, please be reminded to check your emails for our follow-up message so we can get your feedback from this session. And then once we receive your responses, we'll be sending you more resources. Okay, see you on our next AHIN hour. And this has been Cherise from AHIN. Thank you for joining us and have a great day.
Thank you.
Thank you, everyone.
Okay, bye-bye.
Bye.